Video 3. Flushing and cleaning. You need to prime or fill the extension set with water before attaching it to your child's G-tube. This stops extra air from going into the stomach. To do this, fill an end-fit syringe with water and attach it to the extension set. Unclamp the extension set and push the water from the syringe through the extension set until you see a drop of water come out the other end. Clamp the extension set and then attach it to your child's G-tube. To make sure the tube is not clogged, it's important to flush or use a syringe to push water through the G-tube after you prime the extension set. Flush with at least 3 to 5 milliliters of water. Do this before and after every time you feed your child, and before and after every time you give your child medicine. When cleaning or flushing your child's G-tube, look for any changes around the stoma or hole that might be a sign of infection. This could include redness, yellow or green pus, increased tenderness, pain, or if your child has a fever or temperature over 100.4 degrees Fahrenheit or 38 degrees Celsius. Granulation, some leaking, and slight bleeding are normal. Here you can see granulation, which is pinkish, red-colored extra skin, also called tissue, that forms when a wound is healing. This is common when a G-tube is placed. If the granulation tissue is getting bigger, call the healthcare provider in charge of your child's G-tube. Some leaking, no more than the size of a quarter, is normal and expected. Slight bleeding, no more than the size of a quarter. This is also normal. If there is more bleeding than that, apply pressure over the bleeding area with a gauze pad. If the bleeding does not stop, call your child's healthcare provider. Cleaning the extension set after using it prevents formula or medicines from causing clogs. After you separate the extension set from the G-tube, clean it with soap and water. You can also attach a syringe and use water to flush the extension set. You can reuse extension sets for 1 week. Also, rinse syringes and extension tubing with soap and water after each use. Please hand wash all the supplies because they are not dishwasher safe. Allow supplies to air dry completely on a paper towel or clean surface. Throw away feeding bags every 24 hours. And disconnect the extension tubing from the G-tube whenever you aren't feeding your child. This can help prevent the G-tube from leaking.